One of the keys for a successful clear aligner treatment is good quality diagnostic records. Let's start with discussing dental scans. If you notice any of these issues with your dental scans, please take a few minutes to rescan the patient. Since these issues effectively alter the case's anatomy, a few minutes can save you months of extra treatment time due to the trays not fitting or the case not tracking. The first issue that we observe are voids. To avoid them, make sure to stay on the tooth long enough so that you capture its full anatomy. If you notice voids after scanning, you can just rescan this specific area instead of the whole arch. Also, to avoid bubbles, please make sure to dry all teeth surfaces and maintain good isolation. Posterior teeth visibility is very important since the trays will extend over the molars to provide anchorage for a lot of the movements that we perform. So take a few extra minutes to capture the whole anatomy of those second molars. A common issue we observe with dental scans is incorrect arch orientation. This means that both arches, upper and lower, are submitted having the same orientation. Unfortunately, we can't correct this manually, so we will have to ask you to rescan the patient. So please make sure both arches are in occlusion before submitting your scan. One of the most prevalent issues we observe with scans is their occlusion not matching the picture's occlusion. This can change the entire treatment plan. In this example, we see that, on the pictures, the patient presents with posterior open bite, which may lead us to plan for movements to close it, such as extrusion. As you can see, the scans do not show posterior open bite. In this case, the real occlusion was the one present on the scans, meaning that if we would have treatment planned the case based on what we saw on the pictures, the movements will have not correlated with the patient's actual situation. Please take a few seconds to make sure the occlusion matches between the pictures and scans. Hypercontacts can be present on your scans if the teeth are not properly dry before scanning, just as with bubbles. This will give us incorrect information on your patient's occlusion, so please make sure that all occlusal surfaces are dry prior to scanning. Also, take a moment to check gingival margins to ensure they're properly captured on your scan. To avoid missing them, make sure to rotate the scanner towards the gingiva. If you miss it, you can just rescan this area. Finally, excess material is caused when not enough tooth surface is captured, so the software compensates by adding this material. To avoid creating this, make sure to stay on the tooth long enough so that it can be fully captured.